Children, defined as anyone under the age of 18, make up 36% of the South African population of 54 million people. Over 60% of them live in poor households. There are 3 types of grants that provide income support to the caregivers of qualifying children: the Child Support Grant, the Foster Care Grant, and the Care Dependency Grant. The Child Support Grant is means-tested, and the other 2 grants are not. Children must be under the age of 18 and meet the respective criteria depending on the grant, either living with foster families or living with a disability. Currently in South Africa, the Child Support Grant alone reaches 11 million beneficiaries, the Foster Care Grant close to 500,000 children, and the Care Dependency Grant 130,000 children. The right to social protection is enshrined in the South African Constitution. It requires the government to support children directly when their primary caregivers experience financial hardship.
Bangalova iwona ana matsundzuki impilo ibe nzima kathi aningatirhi vitoma abyitika swinene government lo mina ngikesa a swi tika kusuku ro sungula no loko soka swi nga vuriwi ntavula loko ni ya n'wi teka kaya.
The Child Support Grant is a key income support program. The Child Support Grant is complemented by other services such as free education, school feeding programs, and affordable health services. The beneficiaries use a smart card issued by SASSA, which is the South African Social Security Agency.
The South African Social Assistance Program obviously has been very beneficial, especially to children, and I think other entities, including obviously the UN, has had praise on the program because it has able to reach over 11 million children. And so the program in itself has meant that children obviously out of the poverty line and have been able to improve in terms of getting other assistance, obviously, including healthcare, free basic education. And overall is that you have children now that are obviously functioning in a normal society.
For all grants provided for children, biometric data must be captured for both the eligible child and his parent or caregiver. These data are stored on the recipient's branded smart cards, which are fully functional debit cards. For all payment channels, the SASSA card is the unique means of identification for the beneficiary or caregiver. Ultimately, the government of South Africa envisages to universalize the grant to cover all children in the country and contribute to improving the income security of all of South Africa's children. This effort is part of the country's ambitions to build a national social protection floor in line with ILO's Recommendation 202.
But even taking that notion forward, we're also looking at restructuring the way we provide many of our benefits. So most of, for example, our 3 main benefits, older persons, disability and child benefits, are largely provided on a means-tested basis. In other words, we test people's incomes, and if you're below a certain income, you can get the grant. We're now looking at providing those benefits universally. Basically, anyone in society being able to access those benefits. We've been looking at, for example, extending the child support grant to older children. So instead of just cutting it off when the child turns 18, to say, for children that remain in education and training, it would be useful to continue supporting them so that they can complete their education and training, realizing that, you know, a better trained workforce will ultimately reduce unemployment and create a much more productive society.
You can learn more about social protection programs in South Africa, the ILO's Recommendation 202, and what other countries have achieved in the social protection sector at the ILO's Social Protection Platform at www.socialprotection.org.